I just got done getting a report. I am going to go check my EMR real quick to look at last lab values on my patient and what kind of a shift they had with her last night. And then I'm also going to look for any new orders that I might need to collect or evaluate. Before we go in, I'm just going to check the door, see if there are any special precautions we need to take. Doesn't look like it's just standard precautions. So we'll head on in. Hi, Kaylee.
Hi.
How are you?
Good.
My name's Michelle. I'm going to be the nurse taking over shift this afternoon. How are things going?
Good.
So what brings you into the hospital?
I just got my appendix removed.
Oh, okay. Kaylee, can you tell me your full name and your date of birth?
Kaylee Peterson, 020105.
Okay, I'm just going to check your wristband here. Looks good. Kaylee, just for orientation-wise, can you tell me where you're at right now?
The hospital.
And then what city are you in?
Moorhead.
And what month is it?
December.
Okay, sounds good. So Kaylee's general appearance right now, her skin looks pink, her hygiene looks good, she looks like she's relaxed, she's got good posture, she's alert, her verbal responses to my questions are appropriate, and she's listening well. Kayles, are you having any pain right now?
No.
No. When was the last time you had some pain medication?
This morning.
Okay, so everything's going okay with that? That sounds good. I'm just going to do some vitals on you right away, okay? I'm just going to do a little assessment today. Does that sound okay?
Yeah.
Kaylee, do you know what your blood pressure usually runs?
103/60.
Okay. So I am going to come on here. And have you roll your wrist out for me. There you go. Alright, Kaylee, I started feeling that right about at 90, so I'll probably blow it up to about 110. Let me get my stethoscope here. Sneak it right in. Alright, we got 102/56. That looks good. This is you. If I had a thermometer and a pulse oximeter, I would get her temperature by scanning her forehead, and I'd put a pulse oximeter on her finger with the red light on top of the fingernail. I don't have either, but if I did that, those values I'd get. I am going to listen to the apex of her heart real quick to get a heart rate. Normally I'd listen to this underneath her clothing, but for this assessment I'm going to do it over her clothing. I'll listen for a full minute. Let's sneak in here. Kaylee's heart rate sounds regular. It's 58 beats per minute. I got her respirations at the same time while I was doing that, and they are at 12. I'm just going to check her skin turgor here real quick. And that looks good. It's retracting, no tenting there. If she had an IV hooked up to her, I would look at that as well. Kaylee has already told me she's alert and oriented ×3 as far as Glasgow scale goes. I'm going to just do a little bit of neurological assessment here, Kaylee. I'm going to have you squeeze my hands for me, okay? And then I'm going to sneak in on the inside of them, and I want you to push against them as I push out, okay? Let's do the same thing this way. That looks good. I'm going to sneak in and just feel for your pulses here, if you can turn them out for me. So I would say the strength in her hands are about +5, pulses are about +2. I'm going to check capillary refill here. And that looks good. That's less than 3 seconds in her fingers. So right now Kaylee's been appropriate as far as that her actions have been spontaneous. Her eyes are opening by themselves. Her movements have been purposeful. And her responses back to me have also been appropriate. So I'm going to move down to the lower part of your legs here, Kaylee. I'm just going to check your legs. Have you, can you wiggle your fingers for me? Having any problems with tingling and numbness in your feet or your hands? No. Can I have you wiggle your toes for me? Okay, that looks good. I'm going to look for some edema here. As I'm noting her skin throughout this exam, I'm looking for color, which is pink, and that it's warm to touch. I don't see any edema here going down into her feet. I'm going to feel for her pulse in the posterior tibial part of her foot here. And that's a +2. I'm going to look for the dorsalis pulse here on the top. There we go. And those are at about a +2. Look for the capillary refill on her toes. Those are less than 3 seconds. Kaylee, can I have you push up against my hands? Yep. Now push down. Maybe go out. And you can go in on. I'll have you lift one leg for me. Okay, go ahead and lift the other leg for me. That looks good. So Kaylee's doing good there neurologically. No concerns. Cover things back up here. Alright, Kaylee. I think I actually am going to have you come and swing on the side of the bed here. I'm going to listen to your lung sounds real quickly. Sink in, and you go ahead and breathe in and out. I'm going to make sure I listen for one full respiration. In and out. In and out. In and out. In and out. Posterior lungs here. So far her lungs are clear. Go ahead. In and out. Deep breath. You go ahead and take another deep breath. Another one. Another one. And again. And again. Alright, Kaylee. You can go ahead and lay back down for me. Kaylee, are you having any problems with coughing at all?
No.
The mucus production that you feel like you have in there?
No.
I don't see any orders for any spirometry, but sometimes it's okay just to exercise those lungs and take some deep breaths when you'd like to, okay? So I'm going to sneak in and I'm just going to listen to those 5 points on her heart real quickly. I'll come in here, Kaylee, again. I'm going to go back and listen with the bell. S1's being heard greatest at the apex here, and S2 is the best at the base. skin. Heart rate is regular. Her lung sounds were clear. I didn't hear any crackles or wheezing. She seems to be breathing very unlabored, so that's going well for her. How are things going for mobility for you, Kaylee? Are you able to get up and around as often as you want?
Yeah.
Yeah. Any problems with dizziness or nausea or
No.
no issues there? Is your diet regular right now? Are we feeding you the same, what you're used to, or are we doing a special diet with you?
It's normal.
Normal. How as far as your bowel movements go, when was your last bowel movement?
This afternoon.
Okay, what color was your bowel?
Brown.
And what consistency was it?
Soft.
How frequently are you going? Do you usually only go once a day, or?
Once.
And so you went today, there were no concerns there. How is urination going for you? Having any pain with urination?
No.
How about the color of your urine?
Yellow.
And is it seem to be a lot of volume to it, or are you peeing normally in your mind?
Normally.
Normally, okay. Color, consistency, no pain. So I wouldn't do a bladder scan. I'm not concerned. How often are you going?
Twice a day.
Is that normal for you to only
Yeah,
go
it's
twice? How is your fluid intake while you're here? Are you drinking water?
2 water bottles a day.
Okay. I might push some more fluids to try to get you to go more frequently than that, but that sounds appropriate. So as far as Kaylee's skin go, I was assessing it throughout the exam. It's warm to the touch. It's pink. I don't have any concerns necessarily with skin breakdown at this point because she's not on bed rest. Otherwise, I would be worrying about her repositioning and her turning scale and checking for pressure points. But I would use the standardized scale, the Braden scale, to assess her for any skin breakdown. I'd also use a standardized scale to determine if she's at risk for any falls, which I don't think she is currently. She is on some pain medication, but other than that, she doesn't have any history of falls and isn't complaining of any dizziness with repositioning. Let's see, Kels, I'm going to sneak in and I'm going to listen to that abdomen of yours, okay? And at the same time as I'm listening to the abdomen, I'm going to look at the incision site from her surgery. So I'm going to sneak in here on you, Kaylee. Alright, so Kaylee has bowel sounds to all 4 quadrants. I'm just going to palpate them, Kaylee. Let me know if this hurts too much in that section. How's that feel?
Good.
In here?
Good.
In here?
Good.
And there?
Good.
So Kaylee's abdomen is flat. I don't see any distension or swelling anywhere. The incision site looks good. There's no redness or signs of infection. I am going to just change the dressing here. Take that off and we'll put a new one on. I would have Dawn gloves and put those on before putting this on her, and on hand hygiene. Alright, so that looks good. You know what, Kaylee, one thing that I need to make sure I take a look at too here is I'm going to have you look straight ahead at my nose here. I'm just going to look at your eyes. So looking at Kaylee's eyes, they are about 5 millimeters. They're direct and consensual. Her symmetry is there. I don't notice any ptosis or drooping of a side of the face at all. So Kaylee, I think I have everything covered for my assessment here. Do you have any questions for me?
No.
No. So before I left the room, I would lower the bed. I would lock it into place. Kaylee, I'm going to give you your call light here. You have that. If there was any special equipment, I would make sure I check settings, like if there was an IV drip, if she had a specialized bed. Otherwise, well, Kaylee, thanks for your time, and if you need me for anything, just put on the call light and I'll be here to help you, okay?
Okay.
So clean my hands here before I go.